This is a video to talk about the treatment of Dupuytren's contracture. In Dupuytren's contracture, there's a thickening and build-up of the fibrous tissue underneath the skin, and then over time, this contracts and causes the fingers to gradually bend over. There's often a tight, palpable cord underneath the skin, which isn't the tendon, it's a build-up of excess tissue, and then as it tightens, the fingers curl over. When the first lumps appear, nothing needs to be done, but as soon as the fingers start curling over, we would then recommend treatment. In some situations, it can be appropriate just to treat this with a very simple local anaesthetic procedure where the cord is divided with just a needle inserted through the skin. And this is quick procedure, quick recovery, although the condition can recur afterwards. For different presentations, then surgery, where the whole cord of Dupuytren's tissue is cut out, which can be done under a regional anaesthetic as a day case, but does involve a longer recovery, including hand therapy input and stitches in the hand for a couple of weeks or so. With either treatment, either with the needle through the skin or with the open surgery, the condition can come back. And like with any operation, there are risks. You can get wound infections, there's a small risk of damaging nerves, sometimes the fingers get a bit stiff, and the scars can be a bit lumpy and tender. But with most patients, what we aim to do is get the fingers out straight and they maintain a full grip and back using their hands fairly normally after 3 or 4 weeks. If this isn't treated, then it may progress such the fingers become very bent. That then affects the function of the hand, and it can be more difficult to get a good result if it's subsequently treated. So we recommend that once the fingers have bent that sort of distance, you can't put your hand down flat on a table, then at that point seek an opinion as to whether you should have it treated.